Seasoned nurses, you mind if I have a quick huddle with the student nurses and the novice nurses? I appreciate it. In nursing school, we are all taught very valuable information on how to become a nurse. You need that, make no mistake. However, I don't think a lot of nursing schools do their due diligence about showing you where you can practice as a nurse. Nursing is, without question, one of, if not the most versatile degrees that you can have, because it opens up the doors to a world of opportunities. And I'm going to tell you about at least 15 of them right now. Grab a chair, lock in. We're going to take a quick break from learning about cardiology concepts today because I feel like this is important. So once you get your nursing license, and this also applies to LPNs also for the most part. Now, some of these career paths LPNs can't take, but for the most part, you can. Once you get your nursing license, that opens up a world of opportunity where you can elect, if you want to, you can elect to work bedside. That's cool. Very, very respectable and admirable place to work. You can elect to work in a doctor's office. You can elect to work in urgent care. You absolutely can. However, if for whatever reason you still want to do direct patient care, but you don't want to work in any of those settings, guess where else nurses are welcomed with open arms? You ready for this one? You can work in, everybody knows this, the jail and prison system. You can work on airlines. Airlines do employ nurses. Now, every flight may not have a nurse per se, but there are airlines who will hire nurses to actually sit on flights and attend to any sort of patient issues that may arise, you know, complaints about chest pain, shortness of breath, what have you. Nonetheless, airlines hire nurses. Cruise ships hire nurses. They do. Look it up. Sports venues, stadiums, concert venues, sports teams hire nurses 100%. Now, these jobs are not plentiful to work for, you know, a major sports team, be it football, baseball, basketball. Not saying that they're plentiful jobs, but they are there without question. And you're going to have to be a stellar candidate to be considered for these jobs. But just because that job might be challenging to obtain, that doesn't mean that it's impossible. The jobs are there. All right. Vacation resorts will hire nurses also. It is true. Especially those that are resorts in U.S. territories. Think Virgin Islands area. Think Puerto Rico. There's some people, for whatever reason, military sometimes, go off to Guam. There's resorts over there. They hire nurses also. Keep that in the wheelhouse of consideration. On a little bit of a morbid tangent, because just as nurses help bring life into this world, we also, you know, can help usher people into, you know, their transition. So there are funeral homes who hire nurses also. They do. You can also work in forensics as a nurse and work with your local coroner. If you are the type of nurse who would be interested in investigating like death, crime scenes that involve death, or if you're interested in helping your coroner with an autopsy, they need nurses. Also, recently, at least in Georgia, nurse practitioners have been hired to ride in the ambulance with EMTs. There's so many places that you can work still doing patient care as a nurse or a nurse practitioner that don't involve the traditional hospital, doctor's office, urgent care setting. Now, maybe it gets to the point where you're kind of burnt out on patient care and you want to get away from that part, but you still want to work actively in your nursing scope of practice. There's opportunities for that too. You can do research, of course. There's clinical trials all the time. Hospitals, especially educational and teaching hospitals. In Georgia, we've got the Emory system. They hire nurses all the time to help gather research for their research trials. You can work in administration. At every hospital has a house or nursing supervisor, house supervisor. You've got unit managers, department directors. You've got your chief nursing officer in the hospital, a very, very valiant administrative, high-level administrative position. She's still a nurse, or he's still a nurse. If you want to go work in academia, of course, every nursing school needs instructors for the didactic portion as well as for clinical portion of nursing school. You got to be a nurse in order to be a nursing instructor. Kind of makes sense. Hospitals have their educators on staff. Sometimes it delineates between departments, emergency room, med surge, diabetes educator. There's a lot. Also, if you are concerned about the curriculum that nursing students are learning, you can continue to further your own education and get your doctorate in nursing by way of PhD. Become, maybe a dean of a school of nursing, or at least be in a position to affect the curriculum that nursing students learn. Now, maybe you would like to go into politics as a nurse. You can do that too. Did you know that? You can. There are three states who utilize nurses in the House of Representatives. We sit in high places, okay? Virginia, South Carolina, and Illinois all have nurses in their House of Representatives. As a nurse, you can advocate for political change with regard to the policies that affect how you practice. That's called political advocacy. You can work in your governor's office. You can even work in Congress. There are many, many congressional seats that are held by nurses. Look it up. Again, we sit in high places. And then also nursing organizations, your AACN and your AANP. These are two of the very common boards through which nurse practitioners really will take their board exams. You can volunteer or, pay a nominal fee to be a member of these organizations, but these organizations still employ nurses for staff positions. Say all that to say this. Please don't be pigeonholed or think that you have to be pigeonholed once you get your nursing degree and your nursing license. Please don't think that you are relegated to just working in the hospital setting or just in the doctor's office setting or in the urgent care setting or even as a school nurse. You can work that way also. I don't really know a whole lot about pediatric stuff. I did the adult gerontology acute care NP track. Me and kids and women's health, that's just not my ministry. But, I'm sure that there are a wealth of opportunities with them also. Anyhow, let's wrap this up. Bring this small meeting to a close. I hope this information was beneficial for you. If there's anything that you found new with this information, share it. Share it with your nursing colleagues. And if there's any other positions that I may have missed, educate me. Okay, drop something in the comments. Educate me. Y'all take it easy, all right? Bye.